Keitumetse Mashego, a clinical and sports psychologist as well as life coach, Men's Mental Health Month, joins us to further unpack this discussion. Doctor, a very good afternoon to you. Thank you so much for being with us today. Look, so the stigma associated with mental health, especially amongst men, a story, I'm not sure if you heard in my previous intro there, the issue is always men don't cry. Where did men get this saying, and who says they must practice it?
Unfortunately, good afternoon to everyone. Good afternoon to you. Thank you for having me. You know, unfortunately, society and there's so much stigma around seeking psychological help, especially for men. You know, it becomes quite difficult for them to seek help, unlike the other genders, which is quite sad. Unfortunately, you know, it's been passed on from generation to generation that men should not cry, men should man up, and it's really difficult for them to express their emotions, even when they have the emotions, which then leads to what we have, you know, psychological disorders or even substance abuse, because they're trying to, not feel what they are feeling in spite of them feeling it, which is quite sad.
And Dr. South African men to continue to rank high amongst those who actually take their own lives. What in your research or the information at your disposal do you think are some of the biggest factors that are acting to this? I mean, we know the general one, they will tell you it's either finances or women.
You know, it's sad that our society also puts pressure on men to man up, to be a provider. And once, you know, for example, in society where there's such high rates of unemployment, where men are unemployed, they also get the pressures, but they have no outlets. And also they're not comfortable with seeking help because they've been raised in generations whereby they're told that it's not right for them not to be able to provide. So if they're placed in such difficult circumstances and they're functioning from a place of lack, it's always difficult for them to reach out for help because they're not taught that they should seek out for help when they're not okay emotionally. Because as we always get the narrative that men should man up, which is quite sad. Because in this day and age, we should be be accepting of human beings just having emotions, no matter their gender, including the men. So even us as a profession, we still have a lot of work to do to promote men seeking help. You know, generally society seeking help, but especially the men, because the high suicide completion rate is quite alarming in that gender.
And Dr. Expanding on that point, you made reference to men seeking help. What exactly is this type of help that you're referring to, and also that is readily available to men in South Africa, where they also don't feel stigmatized or judged secondarily? And also, we all know some men really, really find it difficult, as you've just alluded to just open up, even to their peers as well as their friends.
It's quite a sad state we're in, but and I've seen that in practice that actually men do have the medical aid to go and seek out help. Some of them have access to these facilities, but because of the stigma surrounding mental health in general, but especially around men seeking help, and even though they need it, they don't seek out for it until it's quite late, or where there's quite suicidal ideation, or there's been suicidal attempts. But there is help available out there, and my view is that we need to really encourage human beings that you're human. Your emotions are a part of you, that there will be times when you need someone like myself to vent out to, and it's okay. And I think we really need to push the narrative that perfection is an illusion. It does not exist. And if you aim for it, as a man, as a woman, whatever it is your gender, that you're going to miss it because it doesn't exist. And I think men are put in this bubble where they're expected to provide in spite against odds, which is not always possible. Because, look at the circumstances of our reality, especially in South Africa. So we really need to promote them seeking help before it gets so extreme. But also when they start medicating, and remember, it's not just alcohol, it could be over-the-counter medication such as your grandpa, your panado, where they're not okay, where the eating has changed, there's a lot of sleeping disturbance, they really need to seek out help. It's just the check-in. Mental health patients. We're not bad people. We can't just have them come talk to us in a non-judgmental way and tell us what it is that you're thinking or that you're doing, but so that we can help to navigate whatever it is we're going through.
And the classification around specifically mental health, doctor, I mean, looking at the cultural aspect, particularly in South Africa, a lot of people do not understand when you're saying that you're going through mental issues. They will think you're going crazy and you need to be confined to a certain institution because your mind does not work properly. But talk to us about that. How do we classify some of these mental issues pertaining to men?
You know, I always say to people that we on a continuum, that we have extreme cases where someone might need medication, but we do have instances where someone has the trait and they just need that sounding board like myself, who's objective, non-judgmental, and equally just being there for the person. But, you know, just with other things that you might go to a clinical psychologist, for example, and not build the rapport. So it's okay to leave that one and find one that works with you, that gets you, that hears you. Because therapy is also about just being heard, just being listened to, and being helped to navigate life, whatever issue that, you know, is thrown on your lap. And I think that's the issue of mental health stigma that we still need to, honestly, as professionals, really deal with, especially in men, because when they are in society, they feel like they should not feel the things that they feel, but it's inhuman for them to be expected not to feel those emotions that are part of humanity. So there's really still a lot of work that needs to be done, but I'm here to encourage the men to really seek help, to find someone who, you know, they can relate to. And if they find that professional who does not give them what they need, the sounding board, it's okay to find someone else. It's not the end. So really to seek the help until you find someone you can relate to, can help you process whatever you're going through non-judgmentally, in a safe environment where you actually process what you're going through.
I know I'm out of time, doctor. So just in closing, I mean, what is then the responsibility of spouses, of girlfriends, of families, of relatives, of communities in assisting those men to get to a place where they realize that they do need that extra help, and also identifying the fact that somebody's actually suffering in silence?
I'm of view that any human being is at risk to experience any type of psychological problems, and our men also can experience that. And the spouses, the partners, the family members also need to be sensitive in acknowledging that, you know, our male figures in this world who are really trying to make things work. Sometimes life happens, that they need the assistance of professionals, that it's okay that they seek the help that they need. But to also give them the grace, because they're human beings, right? Not to expect them to provide even when they are, for example, unemployed, not working, for them to do the impossible in a very difficult situation. So I think we really need to extend that grace. Also, as people, as we really need to do the work within. I'm of view that everyone should have a clinical psychologist so that they have a sounding board, so that because life happens, right? And also the societal expectations, we really need to ease up on them when it comes to men especially, because that's where the suicide completion rate is so high. Because they're struggling to reach out because society and human beings expect
Absolutely, doctor. So give those hugs and don't expect much, just, correlations. Thank you so much for that valuable input this afternoon. Dr. Keitumetse Mashego, a clinical as well as a sports psychologist, weighing in on men's mental health issues, particularly as we observe Mental Health Month among men during the month of June in South Africa.